I'm Dr. Syamlal, Senior Consultant Neurologist and Head of the Department of Neurology, himself, Trivandrum. I'll be talking about epilepsy. What is epilepsy? And what is the difference between epilepsy and seizure? Epilepsy means when there is uncontrolled hypersynchronous abnormal electrical impulses in brain, it will produce difficulties in patients. It is called epilepsy. Abnormal electrical impulses causing neurological symptoms in the patients is called epilepsy. When a single episode occurs, it is called a seizure. And when two or more episodes of seizures occur, we call it as epilepsy. Epilepsy can be of many types. Primarily, epilepsy can be of a generalized tonic clonic epilepsy, or it can be a focal epilepsy. Generalized epilepsy means the electrical impulses simultaneously occur from both sides of the brain, and the patient will have sudden loss of consciousness. He will fall to the floor, and he will have some jerky tonic clonic movements of the limbs associated with incontinence of urine, motion, and all these things. This is called generalized epilepsy. The second most common type of epilepsy is called focal epilepsy. In focal epilepsy, the abnormal electrical impulses originates from a specific part of the brain. From which part of the brain these electrical impulses arises, the patient will have different type of ictal phenomena. That is the epilepsy phenomena. That means if the patient has got electrical impulses arising from the occipital cortex, which is the visual area, the patient will have seeing objects as colored or some flashes of light or like these phenomena will occur. Or if the electrical impulses arises from the temporal lobe, it is concerned with memory and emotions and all these things. Patient will have abnormal fear, anxiety, or rising abdominal sensations, undue familiarity. These are all called temporal lobe epilepsy. Like any part of the brain can be abnormal and can produce abnormal electrical impulses to produce a focal epilepsy. In certain people, this focal epilepsy can later generalize to secondary generalized epilepsy. So these are the two primary type of epilepsy that we usually come across. And we should all know what are the causes of epilepsy. The epilepsy can be due to so many reasons. Many people ask whether epilepsy is an inherited phenomenon. Is it run in families? Yes, epilepsy can be inherited because on around 20 to 30 percentage of epilepsy usually starts in the age group of 18 to 20, and their MRI and brain will be structurally normal. So these are all called hereditary epilepsies and usually occurs in childhood age groups. That is, of the commonest epilepsy is a juvenile myoclonic epilepsy. That is, an young female, school-going female, 15 to 20 years, will develop recurrent episodes of generalized tonic-clonic seizure associated with some myoclonic jerks when she get up from the sleep. This is the commonest generalized epilepsy called as the juvenile myoclonic epilepsy. Also, epilepsy can be due to injuries to the brain, like when there is a stroke, there is blood clotting or bleeding in the brain, or when there is some traumatic injuries to the brain, or sometimes epilepsy can be or seizures can be the manifestation of brain tumors. These are all structural damages in the brain which can predispose to seizures. So seizures can be hereditary with a normal structural brain, or can be secondary due to structural lesions in the brain. Okay. Whenever a patient comes with epilepsy, you have to consult a neurologist or an epileptologist, and who is trained in treating the epilepsy patients. And they will do certain investigations to find out what is the reason for the epilepsy. They will do a proper history, family history, and everything will be detailed. Questionnaire will be there. And after that, they will decide to go. Epilepsy, as I said, it can be due to structural lesions in the brain, which can be identified by an MRI scan or a CT scan of the brain. And electrical abnormalities in the brain can be identified by doing an electroencephalogram. After finding out the etiology, the reason for the epilepsy, we will decide on the medications or you have to go for a surgical procedure, whatever it is, it has to be decided. Currently, there are a lot of medications available for the treatment of the epilepsy, which are not like the previous 20 to 30 years back, where one or two medications were available with a lot of side effects. Currently, a lot of new medications for treatment of epilepsies is being available, and you can manage the patients. Even pregnant females can have medications to treat epilepsy without much problems to the babies. Okay, so epilepsy can be treated properly with medications, and in certain percentage of patients, around 10 to 20% of patients, epilepsy may not respond to medications, and they may require a surgical option. So you can proceed with a surgery based on the site of origin of epileptic discharges, or if there is some structural lesions in the brain which is producing the epilepsy, you can remove that structural lesion to have a complete remission of epilepsy. So epilepsy can be managed very well with the medications or with the surgery. And in epilepsy, there are so many myths associated with epilepsy, like giving a metallic is something when the patient's getting fits. These are all not correct, and they're not scientifically correct. Epilepsy is a scientifically proven electrical abnormality in the brain, which needs a proper investigation and treatment. And what are the things we should be careful when you are having an epilepsy? The most important thing is, as per the direction of the doctor, we have to take the medications regularly. That is the most important thing. All epilepsy patients has to take the medicines regularly, and it has to be usually continued for a minimum duration of 2 years. That is also very important. Second most important thing is proper sleep. The epilepsy patient should have a proper 6 to 8 hours of sleep, because sleep deprivation always precipitates epilepsy. Another important thing is alcohol consumption. When you consume ethanol, alcohol, alcohol is a brain suppressant. After consuming alcohol, after 24 to 48 hours, there is a high chance of seizure. That is also very important. And another important thing is epilepsy patients should avoid adventurous sports like swimming, cycling, trekking. These are all things which should be avoided by the epilepsy patients. These are all very important things in the management of epilepsy, and they should all aware that these things should be properly done for an epilepsy patient. The most important thing is taking the medications meticulously as per the advice of a neurologist or an epileptologist. So, to conclude, epilepsy is a potentially treatable disease which needs proper investigations by a neurologist, and the patient may require long term medications. Minimum duration is at least 2 years to 3 years based on the type of the epilepsy, and epilepsy can be completely cured in the current era with the medications or even with the surgery. Thank you.